In this lecture, we turn to social justice, a framework that expands ethical concern beyond individual patients and clinical encounters to the structures and systems that shape health outcomes. While other forms of justice focus on distribution, procedures, accountability, or repair of harm, social justice asks a broader and more systemic question. What structural inequities must be addressed to achieve fair health outcomes? Social justice recognizes that health is not determined solely by individual choices or medical care. Instead, it is profoundly influenced by social, economic, environmental, and political conditions. Ethical healthcare, from this perspective, requires attention not only to treatment, but to the social conditions that produce illness and inequality. At its core, social justice is concerned with patterns of disadvantage rather than isolated cases. It examines how historical injustices, institutional practices, and unequal access to resources create predictable and preventable differences in health outcomes among populations. These differences, often referred to as health disparities, are not random. They reflect deeper social inequities. Social justice shifts the ethical lens from what happened to this patient to why do certain groups experience worse health outcomes in the first place. One major focus of social justice in healthcare is health disparities. Health disparities refer to differences in health outcomes that are closely linked to social, economic, or environmental disadvantage. These disparities are often observed along lines of race, income, geography, disability, and immigration status. From a social justice perspective, disparities are ethically troubling because they reflect unjust social arrangements rather than unavoidable biological differences. Addressing them requires more than equal treatment at the bedside. It requires structural change. Closely related is the issue of access to care. Social justice highlights how barriers such as cost, transportation, language, insurance status, and geographic location limit access to healthcare services. Even when healthcare systems formally treat people equally, unequal access can produce profoundly unequal outcomes. Ethically, social justice challenges healthcare systems to consider whether access itself is fairly distributed and whether policies unintentionally exclude vulnerable populations. Another key concern is environmental justice. Environmental conditions, such as air quality, water safety, housing, and exposure to toxins, play a significant role in health. Communities with fewer political and economic resources are often disproportionately exposed to environmental hazards. Social justice frames these patterns as ethical issues rather than mere policy failures. When certain populations consistently bear greater environmental health risks, justice demands attention to the underlying causes. Social justice also emphasizes the socioeconomic determinants of health. Factors such as income, education, employment, housing stability, and food security strongly influence health outcomes. Medical care alone cannot compensate for chronic exposure to poverty, stress, and social exclusion. From a social justice standpoint, improving health requires addressing these upstream determinants rather than focusing solely on downstream treatment. In healthcare practice, social justice informs efforts to address racial and economic health gaps. These efforts may include targeted screening programs, culturally responsive care, and investments in underserved communities. The ethical goal is not preferential treatment, but corrective attention to long-standing inequities. Social justice acknowledges that treating unequal situations identically can perpetuate injustice rather than correct it. Social justice is also reflected in community-based public health interventions. Rather than focusing exclusively on individual behavior change, these interventions engage communities to address shared risks and resources. Examples include community health workers, local prevention programs, and partnerships between healthcare institutions and social service organizations. These approaches recognize that health is relational and collective, not merely individual. Finally, social justice plays a critical role in policy reform aimed at vulnerable populations. Policies related to healthcare funding, housing, education, labor, and environmental regulation all have health implications. Social justice calls for ethical evaluation of these policies based on their impact on those who are least advantaged. This perspective aligns healthcare ethics with broader concerns about social responsibility and moral accountability at the institutional and governmental level.